I'm going to record. Hi, friends. It's Nancy Brooker here, your Living in Yes coach, supporting women who are navigating the challenges of peri and post menopause. So it is July here in Canada, and it is hot out there. And we are talking about that hot topic of hot flushes that so many, really a large percentage of peri and postmenopausal women, and even postmenopausal women, experience. And it's such a challenge because it affects so many areas of our lives, right? It can happen anywhere. It can happen with no notice. It can happen at work. It can happen at the grocery store. It can happen at the movie theater. It can happen, and most often it happens at night when we're sleeping, and trying to get our rest. And then it is completely affecting every other area of our life and making it a lot harder for us to deal with the stressors that are already going on. Never mind that we've piled on these crazy hot flushes too. So I am so excited to have with me here today Vonalee Gilroy, who's a registered acupuncturist and is going to help us get a little bit of a perspective from traditional Chinese medicine and what is happening in our bodies and how we can help to sort of mitigate and manage these symptoms. And here again, we're not just going to talk about the symptoms, we're going to talk about the stress, how to mitigate and manage the stress about the symptoms, because that's just as important. So I just want to read to introduce Vonalee to you. Vonalee is a registered acupuncturist with a deep-rooted passion for holistic health, holistic wellness, especially in the worlds of skincare, hormone balance, and digestion. Since graduating from the Calgary College of Traditional Chinese Medicine and Acupuncture in 2010, she has been on a continuous journey of growth and discovery, constantly expanding her craft. What sets her apart, her approach apart, is that she combines knowledge of acupuncture with holistic care. And for her, it's not just about treating symptoms. It's about developing a connection with her patients and empowering them with knowledge. I love it. That's what we're here to do today. And she strives to create an environment where people feel seen and heard. So, Vonalee, welcome. We're so excited that you're here talking with us today.
Thank you.
Yeah. So I always like to find out a little bit more. I know our viewers would like to know a little bit more about you. How did you get into this world of acupuncture, and how did you end up specializing with women who are dealing with peri and postmenopausal symptoms?
Well, like a lot of practitioners, I think my journey into Chinese medicine and acupuncture began with some of my own health problems, and it was the only thing that helped. And I thought this is amazing. Um, that was 14 years ago. Seems like a long time ago, so I've learned so much more since then.
Mhm.
And I guess just mainly being more focused on menopause and learning more about it was seeing, because of my own patients struggling and trying to help them more, I started delving into it, continuing education, going to courses, talking to people, just getting more and more and more.
Right.
And yeah, that's
Yeah.
mainly what got me focused on it.
And it's certainly an area that is often underserved and very much in need. So it's great that you've
Definitely.
decided to do that. Yeah, yeah. So tell us a little bit. We've talked in other videos about where the hot flashes might be coming from a more mainstream medicine point of view.
Mhm.
From the TCM point of view, like what is a hot flash? Where is it coming from? What's happening in our bodies?
It's an imbalance. Chinese medicine is all about balancing the body so that it works properly, and we
Mhm.
don't have disease, discomfort, things like that. Um, just briefly, there's excuse me, there's a balance of yin and yang in the body. We've all heard of those terms.
Mhm.
Um, and the yang is like the gasoline in the engine. It keeps us warm, it keeps us active, gives us energy. We say it dominates during the day, whereas yin is like the cooling, moisturizing balance of things.
Mhm.
So especially at nighttime, if that there's an imbalance and we have too much yang in the body, we say yang rises, yin can't control it, and then we're sweating.
Mhm.
So it definitely can happen during the day as well, but at night is it's when we really see it. So what we do with acupuncture, lifestyle, food, herbs, all of those things is to rebalance the body.
Right. Yeah. Yeah. I was going to ask you actually, we
Mhm,
had talked a little bit ahead of this about about what we might talk about today. And I
mhm.
I forgot to ask you about if you work with herbs as well.
I don't, unfortunately. My training is in Alberta, and I was allowed to use herbs there.
Mhm.
But when I transferred my license, for some
Oh,
reason, they
okay.
didn't give
Yeah,
me the the go ahead.
yeah,
So I
yeah.
refer out. I know some other
Okay.
practitioners here in Guelph now that are
Yeah,
wonderful with
yeah,
herbs, so I refer.
yeah. And that's what it's all about, right? Getting connected, just,
Yes.
knowing that there's an option there and that that person is willing to, know, okay, this other person can also help you with this. And
Hmm.
that's what this is all about. So I love it.
Hmm.
So tell us a little bit about, let's start with self-care. Let's start with,
Hmm.
what are some really simple things that our viewers can do today who are experiencing these hot flushes, to help calm their yang. Did I
Hmm.
pronounce it right?
Yeah.
We always
Yeah.
say yin and yang, but obviously that's not right. Yang, um, just to calm that sort of reaction in their
That
body.
reaction. There's a few different things. Lifestyle changes is enormous. I won't start getting into food and things like that, but I would say calming the nervous system is one thing. So meditation, doing guided meditation, yoga nidra, all of those things just help get us back into that parasympathetic state.
Mhm.
Because so many of us live in the sympathetic state where
Yeah,
it's fight or flight all the time. So getting it back down is really important, as well as supporting that. We call it yin deficiency is when we're
right.
sweating. So we want to support that yin. And if you're feeling anxiety, feeling it rise, a lot of women, you feel that heat starting to rise and anxiety comes with it.
Mhm.
One of the things you can do is there's a good point on the wrist. I don't know if you can
Yeah,
see
can you
this.
hold it up a bit
Um,
higher?
bit
Yeah,
higher.
yeah.
Yeah. So it's just from the
Okay.
crease of the wrist. You
Yeah.
just cut down two thumb widths down to
Okay.
here, and then in between, yes, you got it. In
Yeah.
between the tendons, just
Okay.
press in there.
Yeah.
And it's actually a pericardium point, but in Chinese medicine, the pericardium has the function of protecting the heart. And the heart has a lot to do with sleep issues. It can be
Mhm.
anxiety because anxiety can come from that.
Yeah.
So that right away that helps calm the heart and our you know emotional state as well.
Right. Right. And just rubbing it,
Just
right?
rub it and press. Yeah,
Yeah. Yeah.
yeah, that's all you have to
Perfect.
do. And
Yeah.
and breathing exercises too are really simple to do to bring that, again, bring you back into the parasympathetic state. That's something that
Yeah.
no one has to even notice you're doing it. You can just do it
Yeah,
anytime during
yeah.
the
We
day.
did actually a few episodes ago, we did an episode on emotional freedom techniques using EFT
That's
tapping
great.
to calm your sympathetic nervous
Yes,
system down.
so
And
valuable.
yeah, yeah. Yeah, so can you give us a few others? Like,
Um, when we're and like I said before, the yin function in the body is more cooling and moisturizing, so you don't want to burn yin. So things, just quickly getting into foods that are very heating, like alcohol, coffee, recreational drugs,
yeah,
smoking, all those things are very heating and burn yin even more. Stress burns yin, unfortunately.
yeah,
But you want to protect that yin and don't overdo the hard exercise, or going to Bikram yoga. That's the last thing you want to do.
hmm,
I had a patient a few years ago who we were treating her, and she was progressing really nicely, and then she plateaued during treatment. So we went, I said, well, let's get back to basics and go over some of the basic things, her lifestyle and what you're doing. And I found out she was doing Bikram yoga every week. So she was just burning off that
yeah,
moisture that we were trying to preserve. So
yeah,
so she took a break on that, and she progressed even more and felt
yeah,
felt better.
yeah.
So
And it is interesting at this time in our lives, when we're, in peri and, postmenopause.
mhm,
Um, our bodies have a lot harder time recovering. So when we're
yes,
stressing our bodies, and we're not allowing the recovery too. So it's almost like, there is a balance between what you should be doing and allowing the recovery. Because I think, sometimes we forget.
mhm,
We think we're
definitely.
still 25. We're not, right? And
Yeah,
we just think we can go, 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 and our bodies will just do what they need to do, but we have to give them the opportunity to recover. And
definitely.
so I would imagine that not allowing recovery also would burn
Hmm.
in, did I say
Yeah,
it correctly?
exactly.
Yeah, yeah, yeah,
Yes.
something else.
Yeah.
Are there any other, like, is there maybe one more point that we could show people that they might be able to use? I know that, there are some points that, it's hard to
Yeah.
show here because they're not,
Yeah.
on this
Yeah.
part of
Yeah,
the
exactly.
body, but yeah.
Yeah. Actually around the ankles, there's some good yin points that you can
Yeah.
massage. I would just even and it's good that we have Google. You can just Google. I would acupuncture, and then spleen 6 is one of the good
Yeah.
points. It's on just
And
above the,
is that the one that's above the ankle?
yes, on
Or
the inside.
yeah,
Yeah, that's a good yin point. There's also another kidney point. Kidney 3 is
yeah.
around the ankle, and those are good
Write
ones
this
to
down to
massage.
put in the show notes. So sorry, what did you say?
Yeah.
One is kidney
Spleen
3
Kidney 3,
and spleen 6.
spleen 6.
Yeah, I don't know the names, but I know I've
That's
used
okay.
the points.
Yeah,
Yeah,
that's okay. Yeah, and those are
yeah.
just briefly where those names and numbers are coming from is there's main pathways of energy that run through the body. They overlap the nervous system, and they all energetically each connect to an organ. So that's how we can affect the organ, is by choosing certain acupuncture points along there. And either do you want to support that organ, or does it need to be calmed down? That's why we use points. In this case, we want to support that yin and
Towards
support
the
what
end.
the organs need
Yeah.
to do.
Okay. Okay,
Hmm.
so what I'll do is I'll put in the notes below the video, I will put a link to a diagram somewhere on the
That's
internet
great.
that shows
Hmm.
those points. And sorry, what was this one called?
Pericardium 6.
Pericardium 6.
Yeah.
Okay, I'm just writing it down so I don't
Yeah,
forget.
you bet.
Okay, so great. So we've got a kidney 3, spleen 6, and pericardium 6. And it's
Yes.
just a matter of, I cut my hand here.
Oh, yeah.
It's just a matter of rubbing there in
Rubbing it,
between.
press
And
it.
it's a
Yeah.
big area, right? So if you're rubbing it with
Well,
your thumb, you're
it's
gonna,
you want to get in between the tendons
yeah,
as much as possible. But yeah, right in the midline,
yeah.
pretty much
Yeah,
of
yeah.
your
I
wrist.
think I
Yeah.
think it's pretty safe to say that your thumb is, the acupuncture
Yeah.
point is actually quite small. Your thumb is like, the moon compared to the
Hmm.
point. So you're probably, as long as you're sort of in that area somewhere rubbing around,
Yeah.
you're gonna get
Yeah.
it. Yeah. So give it a try.
Yeah. Yeah.
I'm here to tell you that I have used these and they definitely work. So um tell us a little bit about somebody who needs more support and would actually be looking for acupuncture. What might that experience look like for them? Because I know for many women that I talk to, um, even acupuncture sometimes, if they've never had it because of the needles, obviously things
Yes.
like, pelvic floor interventions, that sort of thing, it can
Hmm.
be really scary, but acupuncture too, it's a needle. But so tell us a little bit about the experience.
Well, I really like to take my time with people in the treatment room, especially when it's their first time. Of course, it's intimidating. Um, but the initial consult is a little longer because we go through a lot of questions, find out, what your constellation of symptoms are, because it's even within menopause, each person is unique. So some people might need slightly different points than others. And we just find out exactly what you need. We make up a treatment plan, and get you settled in on the table. Um, there's some points I use on the back, as well as the front, around, the ankles, sometimes abdomen, sometimes
Yeah,
head. It really varies, but I
yeah,
take it slow.
yeah,
I start with a couple of points on the legs, and sometimes, as we're talking, I'll pop in a couple of points on the legs. They don't even know, because it's not as invasive as people are picturing.
yeah,
So we
yeah,
take our time, what wait for the comfort level to come up, and then they just rest for about half an hour with the acupuncture, the needles in.
and
And I always check on people. They have a call button
the
too,
bowel
so if they
movement.
need anything, they know I'm right
Yeah,
there. And
yeah,
usually once people have had a treatment, they know what to expect. And then after that, it's very relaxing, because the needles release serotonin in the body as well as other hormones. So people usually have a little acupuncture nap when they're
yeah,
in, which is nice. It brings you back into that parasympathetic state and relaxes you, and you just feel great
yeah.
after. So
And is there anything in between appointments that people would be thinking that would be doing or
I talk a lot about lifestyle changes and
lifestyle? Yeah,
diet and stuff like that. Yeah, after treatment, there's nothing really you can't do. If you're having other therapies, I would give it 24 hours in between, especially if it's something, if you're going to, a chiropractor and having shockwave therapy or something like that, more extreme, I would definitely wait.
Mhm,
But there's nothing that's not
mhm.
safe or that's going to undo the treatment. No.
Yeah.
So just,
Yeah.
oh,
And
go ahead.
what can women sorry, what can women expect from if they're coming to see you for hot flashes? What might be sort of a typical trajectory for how they might work? And bearing in mind, every woman is different, every woman's experience is different. Nobody's is going to have the same experience. What might be a trajectory for them?
Uh, well, typical acupuncture is cumulative. So one treatment builds on the next, on the next, on the next, and the body changes and starts healing. So I tell people typically it can take 2 to 5 treatments to start to notice some change, and after that, I can give you a better prognosis as to how many treatments overall you may need to get you back on track.
Right.
And also the pace of treatments. I like to see people twice in the first week, and after that, once a week, and then the body shifts and heals, and we kind of go from there. So
Right.
that's usually, but it's important. I'm always telling people you got to come in at least, once a week,
Yeah.
because it's very important. If it's 2 or 3, every 2 or 3 weeks, it's just not going to be as
It's not,
effective.
yeah.
So regular treatment is
Yeah.
key.
Yeah.
Yeah.
Makes sense.
Hmm.
Right. Okay, so before we wrap up, let's just, I'm thinking I'm just gonna, I know I'm wearing a dress, but I'm just gonna put my foot up and
Yeah. Excellent.
show people where this point is.
Yes.
Can I do that? Yeah, I can.
Yeah. There
Okay,
you go.
so I know, so you would go is it from the top of your ankle? The
It's
four
from
fingers?
it's from the medial
This is a lot
malleolus.
harder than I thought it was gonna be. I thought it
Yeah.
was a good idea to try this. I'm
So
gonna put
yeah,
my
put
camera down. That's gonna be
the edge of, yeah, you bet. Just put the edge of your hand on your medial
Oh,
malleolus,
I've got a big bruise there
three
too.
fingers. Yeah,
Yeah, there we go.
a little lower over that bone. Yeah, and
Yeah,
then the point is right there.
right
Yes, just
there.
off. Yeah,
Yeah.
just
And
off
you're just,
the bone.
and I know that I'll tell you that you'll know you're on the point because it'll hurt.
It could be a little sore. Yeah,
Usually.
yeah, which
And then,
isn't a bad thing. It's your body telling you that no, this needs a bit of attention.
yeah, yeah. And then let's talk kidney 6 or kidney 3. Sorry.
Yes, yeah, that's
Okay.
in between.
While I have my foot and my bruises and everything,
Yeah,
tell me about how to find kidney 3.
so it's in between the medial malleolus, that bone. It's halfway between that and the tendon right behind it. So yes, right in there.
Just
You
right in
got it.
there. Yeah.
Yeah, right in
There
there.
you go. And it's
Yeah,
just rubbing right
just
there.
rub it,
So
press
it's so
it.
easy. So we're rubbing. Can we see that?
Yes, yeah, I
We're
can see
rubbing
it on
in
my end.
here,
Hmm.
or we're putting our hand on here, and where your thumb lands, we're rubbing.
Yeah, just off the bone.
Yeah.
Yeah,
And you can feel it. You can
it's a
totally
bit of
feel
a,
it.
yeah, there's a bit of a
Yeah.
depression.
Yeah. Yeah. And you can feel the sensation of, oh, there's something there. There's something, um, to work on there. There's something to work
Yeah,
out. Yeah.
exactly.
Okay, now that I've shown everybody all my injuries.
Your summer injuries.
I know, eh? This is the dog, actually. The dog did this one.
Oh,
Um, Trying to hold her on her leash. But anyways, uh,
yeah.
thank you so much for being here today.
Thank you for
So,
having me.
we've got some great ideas for things that we can do in a pinch if we have a hot flash. We know, and we've talked about before, and I love that you're just reiterating now too the importance of nutrition and lifestyle and so many other
Mhm.
things. It's a whole, it's not just one thing, it's a whole package of things that you can look at. Does that mean you have to change everything at once? It does not. It means pick something small, like, an acupressure point,
Mhm.
going to see an acupuncturist, whatever that is for you, whatever that little thing is that you can do. So I'm so grateful that you were here today. How about we just let people know how they can reach you before we go?
The easiest way is to look online on my website, and my contact information is there. Um, it's just Vonalee ACU.
Mhm.
I'm sure Nancy will put in the
I
notes
have
because
that one. Yeah, and
my
I'm
name
gonna
is a
put
little
that on the
different.
notes too.
Yeah.
Yeah,
So,
yeah,
and you send me if you have questions, I'm all definitely send me questions
mhm,
because people don't know anything about acupuncture and they're scared of it, but it's actually not that. It's
Mhm.
wonderful. It's a wonderful
Mhm.
medicine, and it's less scary than you think. So shoot me a
Yeah.
note, text, email, whatever you'd like. And yeah, I'm here
Awesome.
to support.
Okay. Well,
Yeah,
thanks so much. I
yeah,
really
you bet.
appreciate
Thank
your
you,
time.
Nancy.
All right.
Thank you.
All right. So now I just have to figure out how to stop recording. There we
Yeah.
go.